All right, it's 5 o'clock now, so let's get started. I would like to welcome everyone who is tuning in with us virtually to tonight's lecture on prostate cancer. We are hosting this event in recognition of Prostate Cancer Awareness Month, and I would like to thank our speakers for participating in this event and welcome urologic oncologist Dr. Stacy Loeb and certified genetic counselor Tamara Braid for participating. Before we get started, please take note of the Q&A box that is on the bottom right-hand corner of your screens where you can submit questions for the speakers, and we will take all questions at the end of the webinar.
Okay, so I'm gonna jump in and talk about hereditary prostate cancer and genetic counseling. My name is Tamara Braid. I'm a genetic counselor with the high-risk cancer genetics team at the Perlmutter Cancer Center, and I'm so happy to be talking to you all today about hereditary prostate cancer. So prostate cancer is common. About 15% of men will be diagnosed with a prostate cancer in their lifetime. And most of the time, 70% of the time, their prostate cancer is what we would call sporadic. So that means that there's not one single cause of their prostate cancer. It's multifactorial, lots of different factors coming together that causes the prostate cancer, such as aging, lifestyle factors, environment, hormones. What I'm going to be talking about today is the other 30% of the time. About 20% of the time, if a man is diagnosed with prostate cancer, we can categorize that as familial. And that's when we're seeing lots of other men in the family with prostate cancer as well, without an identifiable genetic cause. And lastly, most rare is hereditary prostate cancer, which happens around 10% of the time. So I'm going to start by talking about hereditary prostate cancer. And when I say hereditary cancer, what am I talking about? Well, let's go back to high school biology. As you guys might remember, our bodies are made up of millions of cells. And in our cells, we have DNA. And there's specific parts of our DNA called genes. And we have genes for everything, right? Our eye color, our hair color, whether or not we have the ability to become the next Einstein. And we also have genes that are protecting the body from getting cancer. So we all have these genes, and we want these genes to be working properly. For every single gene that we have, we get 2 copies of each gene. We get 1 copy from our mom and 1 copy from our dad. Sometimes individuals are born with what we call a mutation in one of their genes. Whoops. So what our genes are doing, our cancer genes, is they're creating a protein. And this protein is actually what's going through our cells and protecting the cell from developing into a cancer. So if somebody is born with a mutation in one of their cancer genes, they're creating a damaged protein which cannot protect the cell from developing cancer. And so people with mutations are born predisposed to develop into a cancer, which I will demonstrate here. My slides are very slow with switching, so sorry about that. Here we go. So anybody can develop cancer, okay? And 70% of the time, if a man has a prostate cancer, it's sporadic. And the top image demonstrates how somebody develops a sporadic prostate cancer. So they're born with all of their cancer genes working properly, no mutations. However, people can acquire mutations throughout their life. So if a man has a cell in his prostate with the cancer genes working properly, he can acquire mutations in that cell, which then would develop into a prostate cancer if he acquires a mutation in each copy. And that's how the tumor is developed. Now, somebody who's born with a hereditary or a genetic predisposition to develop a cancer, they're born with a mutation that is present in every single cell in their body, including their prostate cancer or their prostate cells. And so you can appreciate that they're just that one step closer to developing a cancer because they only need to acquire 1 mutation instead of 2, and then they'll develop a cancer. But Being born with a mutation does not mean that you will develop a cancer. It just means that you're predisposed and you have that increased risk. So there are some lucky people who, despite being born with a mutation, never develop a cancer. Like so, very slow. Okay. So how do we determine if you're in that 10% of men that have a hereditary form of prostate cancer? Well, we look at your personal and your family history. Men with metastatic prostate cancer are 4 times more likely to have hereditary or a genetic form of prostate cancer. And men with high-risk prostate cancer, defined as having a Gleason score of 7 and above with other family history factors, they also have a greater likelihood of having a hereditary form of prostate cancer. The factors that we look for in a family history would be other people in the family with prostate cancer, or other cancers in the family that may be genetically related to prostate cancer. So those would be cancers of the breast, ovary, and pancreas. We're also looking for early onset cancer, so diagnosed under the age of 50, and looking at ethnicity. Those with Ashkenazi Jewish ancestry have a greater likelihood of having a hereditary form of cancer. Mutations in lots of different genes can cause hereditary prostate cancer, but as you can see, the most common is BRCA2. This is named for the breast cancer gene, but it's a gene that we all have, men and women, and it increases risk of developing several types of cancers, including those of the breast and the prostate. And men with BRCA2 mutations who have prostate cancer, it is linked with having a more aggressive form of prostate cancer, so more likely to be metastatic or have a higher Gleason, and perhaps diagnosed at a younger age than what we'd expect with sporadic cancer. So men with BRCA2 mutations have an increased risk of getting cancer compared to men in the general population. Anyone can get a cancer. And men with a BRCA2 mutation have an increased risk of getting a prostate cancer and a male form of breast cancer. So I wanted to highlight that one because while the risk remains pretty low at 6%, there's a significant increased risk compared to the risk in the general population. And it's a really rare type of cancer that's not often discussed. Women with BRCA2 mutations have an increased risk of breast and ovarian cancer, and both men and women have an increased risk of pancreatic cancer and melanoma. Individuals with BRCA mutations, we can change their medical management to try to reduce their risk of getting cancer in the future. So men with BRCA2 mutations, we would suggest that they start screening their prostate earlier than in the general population. So we'll start them off with a yearly PSA blood test and digital rectal exam at age 40, which is younger than in the general population. And we'll have them do self-breast exams at age 35 and clinical breast exams, which is done by their physician, and consider mammogram at age 50 if there's sufficient breast tissue. For women, we'll increase their screening of their breasts. We start them at age 25, which is much earlier than in the general population. And we'll use a breast MRI, which is a tool that we don't typically use for women at general population risk. And women can also opt for prophylactic surgeries, so removing organs to prevent cancer from developing in that organ, such as removing their breasts and removing their ovaries. As you can see right now, unfortunately, we don't have any screening or surgical options for pancreatic cancer, but the hope is that we would have screening options for pancreatic cancer in clinic very, very soon. So how do we find if somebody has a mutation, a BRCA2 mutation, or a mutation in a different cancer gene? Well, we do genetic testing. And genetic testing can be done on either a blood or a saliva sample. And it's like a spell check, looking at each cancer gene letter by letter, looking for changes. And if a change is identified, it's called a mutation. So as you can see in the image here, at this specific location where there's supposed to be a letter T, there's a letter C. And so that damages the gene, damages the protein, and now this person has an increased risk of getting cancer just based on one letter change. What are the benefits of genetic testing? Well, it can help us better understand the reason for your cancer diagnosis or for your family history of cancer, understand your risk of getting other forms of cancer in the future, and it may influence treatment. For men with prostate cancer, if you are found to have a hereditary form of prostate cancer, you may benefit from treatment with a PARP inhibitor. And it's also important information for family members. So sometimes I'll see men with a personal and a family history of prostate cancer, no other types of cancers in their family. And if they test BRCA2 positive, they are found to have a mutation, and they have daughters, this information could be very important for their daughters. And we could potentially prevent them from ever developing a breast or an ovarian cancer in their lifetime. And I want to highlight the accessibility of genetic testing. Results take only a few weeks. In the past, it used to take months. The out-of-pocket cost typically doesn't exceed $250, and actually it is often less than $100. It used to cost thousands. Medicare does cover the cost of genetic testing for men with metastatic or high-risk prostate cancer, and sponsored no-cost genetic testing is also available. So I talked about hereditary prostate cancer. What if you are a man with prostate cancer, family history of prostate cancer, and you do genetic testing and your test is completely negative? It's normal, there's no identifiable mutation. Well, that's where you may fit in the other piece of the pie, the familial prostate cancer slice of the pie. This is when we see more prostate cancer in a family than what we'd expect if the cancers were all sporadic and independent from one another. When it comes to genetic risk of getting cancer, it's not just our genes. We have genes that protect our body from getting cancer, but we also have other bits of our DNA that we haven't necessarily discovered yet that in combination protects the body from getting cancer as well. And so it's possible that the family members with prostate cancer have mutations in parts of their DNA that we didn't test and we haven't discovered yet. And if they're part of the same family and they have shared lifestyle, then that could be the cause of the prostate cancer as well. So for instance, if you and your brothers all have developed prostate cancer, but you were raised on eating 5 hot dogs a day, which Dr. Loeb will talk about in her presentation, then maybe the fact that you've had, an unhealthy lifestyle in combination with other genetic factors is causing us to see these clusterings of the prostate cancer in the family, even though the genetic test is negative. So we can still use that information to help other family members. So prostate cancer is actually one of the most heritable forms of cancer. So outside of having an identifiable mutation, it's very genetic. It has a strong genetic component and it runs in families. We do know this to be true. So if you are a man without a prostate cancer and you have a first-degree relative with a prostate cancer, so that's a father or a brother, then your risk of getting prostate cancer is double that of the general population risk. And if you have even more family members with prostate cancer, then your risk increases. So if somebody who has a personal and a family history does genetic testing and the results are normal or negative, I do recommend that they repeat genetic testing in the future, maybe in 5 or 10 years from now, because genetic testing is constantly evolving, and it's possible that in the future we'd be able to understand or identify the genetic cause of the prostate cancers in the family. So ideally, genetic testing is ordered by a healthcare provider with special training in genetics, such as a genetic counselor like myself. Genetic counselors are master's level trained healthcare providers with special training in genetics. And genetic counseling is simply just the process of seeing a patient, ordering a genetic test, and disclosing the results. So at a genetic counseling appointment, what I do with my patients is I go over their personal and family history information. I do a medical intake, and we discuss their exposure history and their diet and lifestyle information. And I also take their family history and I draw a pedigree, which you can see on an example of on my slide. And then I go through what gene might be the cause of the cancers in the family. We discuss genetics and go through the informed consent process. Then we order an appropriate genetic test. Once the results are received, then I go over the results with the patient. And if the results are positive, so we do identify that the patient has a mutation, then I will make specific medical management changes and referrals based on whatever gene they have a mutation in. And we'll identify what other family members should do genetic testing and how their management would change based on this new genetic diagnosis. If the results are negative, so there's no mutation identified, I will still use the patient's personal and family history information to make medical management recommendations. So for instance, if my patient's a man with prostate cancer and his mother had melanoma several times, well, I'm going to want my patient that has a family history of melanoma to be careful in this time and get his skin checked by a dermatologist. Now, the last two things that I wanted to cover today are kind of hot topics in genetics right now. So the first is direct-to-consumer genetic testing. It can tell us a lot of things, like uncovering family secrets, but what it can't tell us is whether or not somebody has a mutation in a cancer gene. Direct-to-consumer genetic testing has a high false positive rate. So around 40% of the time, if a mutation is identified on a direct-to-consumer genetic test, it's actually a false positive. So all mutations identified on direct-to-consumer genetic testing should be clinically validated. And the test also can provide a false assurance to patients who do have a risk, because while they do test some cancer genes, for prostate cancer, for instance, they're testing 2 prostate cancer genes, BRCA1, BRCA2, out of at least 19 possible prostate cancer genes. So it's not comprehensive in that way. And of the 2 genes that the company does test, they're only testing for 3 mutations out of possible thousands. So direct-to-consumer testing is not comprehensive clinical testing, and everybody who needs genetic testing should do clinical testing. And lastly, I wanted to talk about the TARGET study. Dr. Loeb and I are working on this study together in conjunction with other colleagues across the US. And this study is really looking to increase the accessibility of genetic testing through educating providers, through educating the general population, and also through studying a new model of genetic counseling. So instead of seeing a real-life genetic counselor, we are testing the use of web-based tool whereby a man with prostate cancer who meets criteria for genetic testing will watch 9 educational videos and answer quizzes that goes through everything that he needs to know prior to the genetic test being ordered. And we're doing this so that we can meet the demand for all of the men who do need genetic testing and to increase their accessibility to get appropriate genetic testing. So that's everything from me. For those who feel like they would benefit from genetic testing, please talk to your doctors to find an appropriate referral. And you can also go to nsgc.org to find a genetic counselor in your area. So I will get Dr. Loeb's slides up.
So welcome everybody to today's lecture. We're going to talk a little bit about prostate cancer awareness. Next slide. The prostate is an organ. It's only found in men, and it is near a lot of other important organs, including the bladder, urethra, and rectum. There is a test that can be used called prostate-specific antigen. and that test can be used to check for prostate cancer. Next slide.
So we are discussing prostate cancer statistics first. It is the most common cancer in men and second leading cause of cancer death. Next slide. So today we're going to talk a little bit about some of the risk factors, prevention strategies, etc. Unfortunately, there is no proven way to prevent prostate cancer. There have been a few randomized trials. One was of Proscar medications to try to prevent prostate cancer. That was not approved. Other studies have looked at various supplements. Bottom line is there isn't a proven prevention, so the best approach is really healthy diet and lifestyle and regular screening. Next. So there are a few non-modifiable risk factors. We heard a lot about genetics and the family history piece. Also age, the risk of prostate cancer increases with increasing age, as well as African American men have a higher risk of prostate cancer. Next. So family history does include all of the possible genetic factors. Additionally, though, families often share lifestyles, and it can affect screening practices where if somebody in your family has had prostate cancer, you may be more likely to get screened. Next slide. So how do we determine what actually is the cause of family history leading to a higher risk? One of the ways is comparing the rates of prostate cancer between identical and fraternal twins. There have been a few such studies, and bottom line is it's about half and half genetic and half lifestyle. So that does mean that we have some potential action items to work on. Next slide. And you'll see that prostate cancer incidence really varies quite a bit around the globe. There are certain places where we have a much higher incidence, and this does include the US as well as Australia and parts of Northern Europe. Next slide. And the bummer about the whole thing is that if individuals from a country who are at lower risk, such as Japan, migrate to the United States, they actually develop a higher risk than they had when they were in Japan. So there does seem to be something that occurs when one moves to the US and adopts the US lifestyle that increases the risk above the native country that was lower risk. Next slide. One interesting consideration about this is diet, and you can click on the button a few times to show that dietary patterns, if we just go back, really mirror the incidence trends. So you can see, for example, the per capita milk consumption and per capita red meat consumption maps look a lot like the prostate cancer incidence map. So there are just aspects of the Western diet that really increase the risk of prostate cancer as well as other cancers. So on the next slide, I'll tell you kind of a summary of some of the dietary factors that we've seen that relate to prostate cancer. On the beneficial side, we have lycopene and cruciferous vegetables. This is things like broccoli, cauliflower, Brussels sprouts, green leafy vegetables. Soy is thought to be possibly beneficial. Fish is usually considered prostate healthy, as well as coffee and green tea intake. Whereas there are numerous studies suggesting that dairy, in particular whole dairy products, so this is whole milk, cheese, ice cream, are detrimental, as well as meat. This includes red meat and processed meat. Next slide. So I don't think that this is widely known, but the World Health Organization
considers processed meat as a group 1 carcinogen proven to cause cancer. This is the same category where you would find smoking, asbestos, other known causes of cancer. So if we're talking about products like bacon, pepperoni, hot dogs, these are processed meats and should be avoided. And then the group 2A are the other red meat products, such as steak, pork, lamb. Next slide. And the reason for that these foods can be carcinogenic is a few things. First of all, it's the cooking process. High temperature cooking involves formation of heterocyclic amines. There may also be some hormonal effects, as well as the nutrition composition of meat-based diet, where there's just more inflammatory substances and less compounds such as antioxidants that fight cancer. Next slide. Also really important to talk about is physical activity and maintaining a healthy weight. So obesity is known to increase advanced prostate cancer. So it's really important to try to maintain a healthy body weight, and physical activity is very beneficial. This is beneficial for prevention, also for individuals who already have prostate cancer. Next slide. In fact, the American Cancer Society has a series of survivorship guidelines for men with prostate cancer. And some of their recommendations are maintaining a healthy weight, engaging in at least 150 minutes a week of physical activity, eating a diet that is high in fruits, vegetables, and whole grains, and avoiding smoking. So next slide, I'll just summarize this section by saying that you want to avoid whole dairy, red, and processed meat, and try to increase intake of green leafy vegetables, tomatoes, and whole grains. Exercise and maintaining a healthy weight are very important. So next slide, we'll go on to prostate cancer screening. And that is primarily done with the PSA blood test. The prostate produces this substance called PSA, and there is more of it in the blood of men when the prostate grows, or if there is a tumor present. So it is kind of like the check engine light is coming on in your car. If the PSA goes up, it tells you that there's something happening in the prostate. That something is not always cancer, and so it's not an absolute indicator, but it does suggest that you need to see a physician and talk to them about what's going on. Next slide. And that discussion is something that is called shared decision making. So it's important that men understand the advantages of screening, which is to try to find prostate cancer early. Prostate cancer does not have any symptoms at an early stage, so the screening process is very helpful to find it at a curative point. However, because the tests that we have are not perfect, men who are making this decision and their families should be aware of the uncertainties involved and discuss with the doctor their own preferences. The next slide, we'll just start to go through what are some of those advantages of going forward with screening, and one of them is an earlier stage at diagnosis, which makes curative treatment possible. Because of screening, we've seen decreases in metastatic prostate cancer and decreases in prostate cancer death. Next slide. But we have some disadvantages. As I mentioned, false positives. This test can increase when there's an infection, inflammation, or enlargement in the prostate. So that may cause anxiety for men who do not have cancer. On the flip side, we can also have false negatives, where some very aggressive prostate cancers do not make much PSA, but that is less common. So the solution to try to prevent these issues, first and foremost is to check PSA at the right time. I have seen individuals whose PSA was checked when they came to a physician with a urinary tract infection. The problem is infection makes it go up. So that would not be the right time to check it. It has to be after the infection is already gone. Also, in terms of false positives, now we have many other marker tests that can be used to confirm whether the results are suspicious for somebody who does have an elevated PSA. Next slide. Some other limitations are that once the PSA is confirmed to be elevated, if we are concerned, the way to actually determine if prostate cancer is present is by doing a needle biopsy. This is an invasive procedure involving needles into the prostate, so that can have some side effects. And we may find a cancer that would not have caused harm during a man's lifetime. Now, the downside is that prostate cancer treatment can also have some significant side effects, such as problems with erections, urinary control, and bowel problems. Next slide. But we do have some solutions as well for some of these issues. There are new approaches to improve the quality of prostate biopsies, such as using MRI targeting and to increase the safety of prostate biopsy. We also have many new treatment options available all the time for prostate cancer, and there's a lot of effort into looking at ways to reduce the morbidity or the side effects from prostate cancer treatment. And importantly, many patients who have a prostate cancer that is a favorable risk, that is to say, and not very aggressive, may not need upfront treatment. So next slide. So how do you choose what's right for you if you are diagnosed with prostate cancer? It's very important to do your research using trusted sources of information, and also consider consulting with different types of doctors. Urologists treat prostate cancer, radiation oncologists, medical oncologists. So it's possible to get opinions from different doctors and also different specialties. Next slide. This may be even easier now due to the expansion of telemedicine. And in fact, we just completed an international survey of urologists about changes to their practice during COVID-19. And the percent who were using telemedicine increased from 16% to 46%. So it's sure a lot easier to be able to have a telemedicine visit with another urologist. Here at NYU, we've had a rapid increase in telemedicine since March 19th as well. And it's now widely used, and most insurance companies are covering this. Next slide. Another important source of information is the internet. And in fact, the majority of internet users report that they search online for health information. And a reasonable number of people also go online to find others who share the same health concerns. Next slide. Problem with this is, though, that not all the information that is on the internet is accurate. This is an example of a YouTube video that promotes herbal injections for the treatment of prostate cancer. It has more than 300,000 views. However, this is not an approved treatment. Next slide. This led us to wonder, what is the quality of other videos on YouTube? So we studied this last year. We looked at the top 150 YouTube videos on prostate cancer. First of all, we found that they were biased, where more of the videos discussed the benefits of screening or treatment, and fewer videos discussed the potential harms. So that might give a biased representation. Next slide. Also, we found evidence of misinformation, commercial bias, and just poor quality of information. So actually, more than 2/3 of the videos had some form of poor quality or potentially biased or misinformative content. And collectively, these videos reach more than 6 million viewers, which is really concerning. Maybe even more concerning is that the bad videos actually had more views and more thumbs up from viewers. So it raises concern as to whether people who were watching the videos were aware that some of the information was poor quality. Next slide. I do want to end with some positive information, though. There's also a lot of good information about prostate cancer online. This slide is showing some results from the Twitter-based Prostate Cancer Journal Club that I started with the Prostate Cancer Foundation back in 2017. We conduct these roughly once a month over a 48-hour period. If you want to follow the discussion, you can look up the hashtag ProstateJC on Twitter, and we discuss new articles about prostate cancer. As you can see in the table on the right, the number 31.5% there, many individuals are not in medicine. So that is meant to be aligned with the row not in medicine. And these discussions are available to anyone who would like to participate. In general, I think Twitter tends to be where a lot of the physicians and scientists are posting new information about prostate cancer. So I think that is a good place to look. Next slide. So just to summarize some strategies for finding good health information online, very important to just check the source. Make sure that the information is coming from a trusted source. Also, when was the information posted? The problem with online information is that many old websites and pages are just never taken down, but things really move quickly in prostate cancer, and that's good news. So it's very important that you have access to the most recent information based on the newest guidelines. Finally, I recommend asking your doctor for recommended sources of information. And this slide shows just a few of the places that you can look for more information about prostate cancer that are great resources. Prostate Cancer Foundation, Urology Care Foundation, Us2 International, and Zero Cancer are just some of these groups. Finally, coming soon, we have a new study funded called the Engagement Study, where we will be creating a podcast series about prostate cancer and prostate cancer genetics. So stay tuned for that, and hopefully we'll be able to push out more high quality information through there in the future. Thank you so much.
Thank you so much, Dr. Loeb and Tamara, for all that great information. If any attendees have any questions for either of our speakers, there is a Q&A box on the right-hand side of your screen. You can type that in and we'll answer any questions for you. I see one question came through. After the removal of the prostate and a 40-day radiation regimen, what is the next step?
Well, I mean, you should speak to your doctor about ongoing monitoring. Typically, it would involve follow-up of PSA on a serial basis to check if there's any recurrence of the cancer. Also, I recommend the American Cancer Society survivorship guidelines, keeping a primarily plant-based diet, avoiding carcinogenic compounds. Exercise is really important. In the future, hopefully we'll have even better imaging options for patients who are potentially concerned about a prostate cancer recurrence, but typically the first trigger is the PSA test.
Okay, thank you, Dr. Loeb. Are there any other questions? All right. If not, I would like to thank both of our speakers for all that wonderful information. I would like to thank everyone for tuning in and attending this webinar. And if you have any questions, you can email us. We have our upcoming webinar schedule will be posted on the Perlmutter Cancer Center website under the events section. And we will see you soon. Thanks for joining.
Thank you.
Thank you.